If a person for some time is super excited or happy, while afterward he feels highly depressed and sad, because of these mood variations, other people consider him to be very moody. A person may go into high phase for few weeks or few months, and in this phase he feels hyperactive and super energetic. Then he may behave normal. He can be normal for few weeks or few months, or maybe suddenly he'll go into low phase. During this low phase, a person feels very sad and depressed. This may last for few months. Because of these periods of low phase and high phase, a person's behavior is highly unstable. In medical terms, such extreme behavior is termed as mood disorder. Mood disorder means instability of mind. During this phase of instability, person have symptoms of mania and depression. Mood disorder is of two types, unipolar or bipolar. Today in this video, we'll try to understand from psychiatrist Dr. Rajiv Sharma that according to DSM-5, American Psychiatrists Association, what is bipolar disorder and its types. Bipolar means bipolar affective disorder. Bipolar means two poles and disorder means a problem or an illness which affects someone's mind or body. Let's understand this in form of a graph. This is a standing line, where downside represents the depression and the upper side represents mania. This sleeping line represents our mood, our behavior. During depression, a person becomes very moody. They lose their interest in everything. They may feel like crying. They get negative thoughts and they feel very sad and unhappy. And patient may even get suicidal thoughts. Opposite of depression is mania. Patient feels hyperactive. They sleep only for few hours but still they feel highly energetic. They feel overconfident, become too lavish in buying stuff, remain super excited and enthusiastic. They talk too much and because of high energy they are unable to focus and concentrate in any work. They take big decisions without giving any thought. Each one of us, sometimes we feel happy and sometimes sad and most of the time we are normal. But in bipolar, a person when in mania or hypomania feels super excited and very happy. And during depression or minor depression, they feel very sad and depressive and lonely. If you want to understand in detail about the symptoms of depression and mania and about the treatment process, you can watch these videos. The link is given below in the description. According to DSM-5, American Psychiatrists Association, there are 5 types of bipolar disorder. Bipolar 1, Bipolar 2, cyclothymia, substance medication-induced bipolar disorder, bipolar disorder due to other medical conditions. Let's start with Bipolar 1. In Bipolar 1, patients have episodes of mania and major depression. If a patient has symptoms of mania for at least 1 week, and after this episode of mania, he may immediately or after some time go into major depression. And if the symptoms of depression persist for minimum 2 weeks, then these episodes of mania and depression are called bipolar 1 disorder. Even if mania remains untreated, some patient may come out of it without treatment within 3 to 6 months. And this duration in case of depression is 6 to 13 months. But these episodes of mania and depression in bipolar disorder results in a poor quality of life and waste lots and lots of time. But if the correct diagnosis is made and the prescription of the psychiatrist is followed, medicine will start showing its positive results within few months and the patient will feel very good and stable. Now let's talk about bipolar 2. In bipolar 2, patients have episodes of hypomania and of major depression. Hypo means less. A patient with hypomania has symptoms of mania but in mild form. In hypomania, patient feel very confident, overactive. He is extremely happy with everything and he actually enjoys this phase. As in mania, the symptoms are extreme, so everyone around is aware of the illness. But in case of hypomania, family member fails to understand the symptoms and they'll get to know only when the patient do something weird, like making a wrong business investment, or they will take a heavy home loan without consulting anyone. And they can be as unpredictable as went out for a work in the morning but in the evening bought a car on big EMI. After the episode of hypomania, person may immediately or after some time go into depression. And this may be due to the realization of the mistake or just like that. A psychiatrist just needs 4 days to diagnose hypomania. unlike in mania, which needs 7 days. Many a times, bipolar 2 is confused with depression, as in most of the cases, neither family members nor patient themselves are able to understand the symptoms of hypomania. So, if the doctor doesn't take a careful and a detailed history of the patient, doctor may miss out the symptoms of hypomania, and instead of bipolar 2, doctor can make a diagnosis of depression. It is very crucial to make a correct diagnosis of bipolar 2 because as compared to bipolar 1, in bipolar 2 there are more chances to commit a suicide. Now let's understand cyclothymia. Cyclothymia is a mild form of bipolar 2. In cyclothymia, patients have symptoms of hypomania and minor depression. Because of the mild form of mania and depression, most of the time neither family members nor patient themselves are able to understand it. To make a diagnosis of cyclothymia, episodes of hypomania and minor depression need to be there for minimum 2 years for a person above the age of 18 years, and someone below 18 years, this time period is considered to be 1 year. As both mania and depression are in mild form and cyclothymia starts at early years of life, so most of the people think this instability in the behavior as part of their nature, and cyclothymia remains untreated. Other people call them moody. Most of the people in cyclothymia are unable to maintain their marriage and relationship. They have difficulty in performing their jobs. They get inclined towards drugs and alcohol, and they have high sexual desire, and because of this high sexual desire, chances of extramarital affairs and broken relationships are always there, which results in a troublesome life. And in most of the cases, due to lack of awareness, cyclothymia remains untreated. At number 4, substance or medication-induced bipolar disorder. Bipolar disorder may occur due to use of some substances or intake of some medicines. Drug addiction can also cause mania, and in case of excessive drinking of alcohol, it may lead to depression. And in some cases, if a careful diagnosis of hypomania is not made by the doctor, then bipolar 2 may be mistaken as depression, and due to intake of antidepressant, patient may go into mania. Due to intake of some medicines, patient may go into depression or mania. Number 5. Bipolar disorder due to other medical condition. Some medical condition may lead to bipolar disorder. For example, if the thyroid becomes overactive, that is hyperthyroidism, in which thyroid is overactive and produces too much of hormone called thyroxine, which may cause mania. And in case of hypothyroidism, when the thyroid gland does not produce enough thyroid, the hormones to meet the needs of the body, which may cause depression. These were the 5 different types of bipolar disorder. Unfortunately, due to advancement in medical and mental health sciences, treatment of all the bipolar types is available. Jeev and I, Monica, and our beautiful Mind Academy have a mission to share correct information and help millions and millions of people. And if you wish to join our mission, do subscribe, like and share this video with maximum number of people. If you have any suggestion or queries, please share and comment and press the bell icon to get immediate notification. We'll keep on adding such informative videos. If you don't want to miss, do subscribe to this channel.